this model, this is anterior and this is posterior, right? This is our brainstem, okay? And so we can't see the olfactory nerve on this model, okay? This is cranial nerve 2. I'm gonna go through a number first. 2, okay, 3, 4, which comes from the back, okay, 5, 6, 7, 8, 9, 10, 11, 12. Okay, this is all part of 11. So, okay, so this is 12. Okay, and in terms of name, this is optic nerve, cranial nerve 2. 3 is oculomotor. 4 is trochlear. 5 is trigeminal. Okay, 6 is abducens. 7 is facial nerve. 8 is vestibulocochlear nerve. 9 is glossopharyngeal nerve. 10 is vagus nerve. 11 accessory nerve. 12 is hypoglossal nerve. Okay. In terms of your foramen of exit, okay, optic nerve through the optic canal. Okay. Oculomotor nerve, trochlear nerve, abducens nerve all exit through superior orbital fissure. You can see over here. Okay. Okay, and then trigeminal nerve is a big one that branches into 3 branches. The first one exits through superior orbital fissure as well. Okay. You can probably see the fissure better on this model over here. Superior orbital fissure. Okay. The second branch exits through foramen rotundum. So if you look over here, right, following the superior orbital fissure posteriorly, we see the curvature. There are 3 holes that lie along this curvature. ROS, foramen rotundum, foramen ovale, foramen spinosum. Okay, so we're not going to worry about spinosum right now, foramen spinosum right now. Okay, so the first branch of trigeminal nerve exits through superior orbital fissure. The second one exits through foramen rotundum. The third one exits through foramen ovale. And again, on this model, this is superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum. So the second branch of trigeminal nerve, which is the maxillary branch, exits through foramen rotundum. And the foramen ovale is the foramen of exit for the third branch, which is mandibular branch. Okay? And yeah, that's it for this model. We'll make a separate video for another model. Okay, so you should be able to look at the passages or the foramen of exits or foramina of exits and be able to state which cranial nerve by name and number exit through. Okay, so over here, it's not shown clearly in this model, but there's supposed to be little pores. Those are the olfactory foramina through which olfactory nerve travels through. Okay, and here we've got optic canal through which optic nerve, which is cranial nerve 2, travels through. Okay, here we've got superior orbital fissure through which cranial nerve 3, 4, 6, and the first branch of 5 travels through. So that means that's oculomotor nerve, trochlear nerve, abducens nerve, as well as the first branch of trigeminal nerve, that is ophthalmic nerve, travels through here. Okay, superior orbital fissure. And then following along the same curvature, we see 3 holes that line along the same curvature. ROS, right? Rotundum, ovale, spinosum. So we're just gonna worry about these 2. Okay, foramen rotundum is the exit for the second branch of trigeminal nerve, which is the maxillary nerve. Okay, or the maxillary nerve, maxillary branch of trigeminal nerve. And then foramen ovale, it's oval in shape. So foramen ovale, this is the foramen of exit for the mandibular branch of trigeminal nerve. Okay, and then don't worry about this. This is foramen lacerum, but we don't care about that in terms of foramen of exits for cranial nerves. Okay, and then moving posteriorly, we have the internal acoustic meatus. Okay, 7 and 8 travels through here, so that means your facial nerve and vestibulocochlear nerve. Okay, this big one is the jugular foramen, through which 9, 10, 11 travels through here. So 9 is glossopharyngeal nerve, 10 is vagus nerve, 11 is accessory nerve. All travels are here. Okay, and then on either side of the foramen magnum, we've got the hypoglossal canal. This is the foramina for, these are the foramina for hypoglossal nerve, cranial nerve 12. Okay? Okay, can you move in? Great. Okay, so this is the olfactory bulb. If I point to this and ask you to identify the structure, it's olfactory bulb. But if I ask you the cranial nerve, I'm really referring to the filaments that exit through here, which is the cranial nerve 1. Okay, and that's olfactory nerve. Okay, this is optic nerve, cranial nerve 2, cranial nerve 3, oculomotor nerve. Okay. Cranial nerve 4 doesn't show here very well. It actually wraps around from the back, so we're not gonna look at cranial nerve 4 on this one. Cranial nerve 5, trigeminal nerve, is this big one halfway down pons. Okay, and then going from medial to lateral, now you move back to medial. This is cranial nerve 6, abducens nerve. 7, facial nerve. 8, vestibulocochlear nerve. And then you move further downward. 9, 10, 11. So that's your glossopharyngeal nerve, vagus nerve, accessory nerve. And then you move back medially. This is the cranial nerve 12, hypoglossal nerve. Okay, and in terms of foramen of exit, this exits through olfactory foramina. This exits through, so olfactory nerve exits through olfactory foramina. Optic nerve exits through optic canal. Okay. Oculomotor nerve exits through superior orbital fissure. So 4 also exits through superior orbital fissure. So oculomotor nerve, trochlear nerve, abducens nerve, all 3 exit through superior orbital fissure. The first branch of trigeminal nerve, okay, that's the ophthalmic branch, also exits through superior orbital fissure. Can we borrow that model? Superior orbital fissure over here. It's supposed to be a slit. This model doesn't show that very well. Okay, so the second branch of the trigeminal nerve is the maxillary branch, exits through foramen rotundum. And then third branch of 5, the mandibular branch, exits through foramen ovale. Okay. 7 and 8 exit through internal acoustic meatus. Okay, good. 9, 10, 11 exits through jugular foramen. 12 exits through its own passage, which is the hypoglossal canal. Okay, great. Okay, so cranial nerve 1, if I point to this, again, identify structure, then this is olfactory bulb. If I point to this and ask you to identify the cranial nerve, then it's cranial nerve 1. This is the olfactory. Okay. This is optic nerve, cranial nerve 2. 3, this is not very good for seeing 3. 4 is going to wrap around the back, and 4 is not showing here. This is labeled 4, but 4 is actually not shown on this model. It would wrap around from the back of the brain at the level of the midbrain, not the pons. So this is labeled incorrectly. 5, trigeminal nerve. So there's a trochlear nerve is 4. The third one, cranial nerve 3, is oculomotor. Okay, trigeminal nerve is 5, and then abducens nerve is cranial nerve 6. 7 is facial nerve. 8 is vestibulocochlear nerve. 9, glossopharyngeal nerve. 10, vagus nerve. 11, accessory nerve. 12, hypoglossal nerve. Okay, in terms of foramen of exit or foramina of exit, this exits through olfactory foramina, optic canal. Okay, 3, 4, which are not shown here, and 6 exit through superior orbital fissure, and same thing with the first branch of trigeminal nerve. Okay. Oh, can I borrow this model? This is what I'm looking for. Thank you. Okay. So here this model shows, I think this may be the only model, or one of the very few models that shows all 3 branches of trigeminal nerve. So this is the ophthalmic branch of trigeminal nerve, maxillary branch, and mandibular branch. So this one exits through the superior orbital fissure. This one exits through the foramen rotundum. This one exits through the foramen ovale. Okay. So we don't show the branches over here, but this is trigeminal nerve. Okay. So 3, 4, not shown here, and 6, as well as the first branch of 5. All exit through superior orbital fissure. Second branch of 5 again exits through foramen rotundum. The third branch exits through foramen ovale. Okay, and then 7 exits. 7 and 8, facial nerve, vestibulocochlear nerve, vestibulocochlear nerve, exit through internal acoustic meatus. Okay, 9, 10, 11, glossopharyngeal nerve, vagus nerve, accessory nerve, exits through jugular foramen. 12, hypoglossal nerve, exits through hypoglossal canal. And here we have 1, 2, 3, 4 is not shown very well. I think this one's supposed to be 4, but this model is not great for that. Okay, 5, you can clearly see first branch, second branch, third branch, V1, V2, V3, ophthalmic, maxillary, mandibular nerves, okay, of trigeminal nerve. 6, and then 7, 8, 9, 10, 11, 12, I'm not going to ask on this model. It's all a mess over here. Great, thank you. So this is the olfactory bulb, but if I ask for the cranial nerve, then we're looking at the filaments exiting through the olfactory bulb. So in that case, that would be cranial nerve 1, okay, olfactory nerve. Cranial nerve 2, the optic nerve, okay, you can see the optic chiasm, optic tract, okay, and okay, let's go through the cranial nerve first. So this is cranial nerve 3, oculomotor nerve. Cranial nerve 4, trochlear nerve. Cranial nerve 5, trigeminal nerve. Cranial nerve 6, abducens nerve. Cranial nerve 7 and 8, so facial nerve, vestibulocochlear nerve. 9, 10, 11. This is not the best model for it. If I test you on these, it will be on a model or an image where you can tell these apart pretty easily. Okay, so 9 is glossopharyngeal nerve, 10 is vagus nerve, 11 is accessory nerve, 12 is hypoglossal nerve. Okay, and then maybe there's a few structures we could try to point out here. Corpus callosum, fornix. This region is the hypothalamus. This is the pituitary gland with the infundibulum. Okay, this part is the optic chiasm, as we've shown here. Okay. And this is part of the lateral ventricle. The space is the lateral ventricle. This, if I ask you the structure, this is thalamus. But if I ask you the space, I'm referring to the space between the 2 thalamic nuclei. In that case, that's the third ventricle. Okay. We got some choroid plexus over here. Okay. And then this part is the midbrain. Okay. On the posterior aspect of midbrain, we've got the superior colliculite, inferior colliculite, together they are known as the corpora quadrigemina. Corpora quadrigemina. Okay. Above the corpora quadrigemina, okay. By the way, corpus is body. Corpora is the plural form of corpus. Quad is 4, so 4 bodies. Okay, we're only seeing 2 here because this is only half of your CNS. Okay, this is the pineal gland. Okay, remember pineal gland, most of us sleep on our back. And so pineal gland, which secretes melatonin, which is a hormone that regulates sleep-wake cycle, is located on the posterior side of your epithalamus. Okay, this region is epithalamus, thalamus, hypothalamus. Not to be confused with the mammillary body, which is on the interior side. Okay, mammillary body. Okay, so these structures, again, optic chiasm, okay, pituitary gland with the infundibulum, and then posterior to that we have the mammillary body. In terms of brainstem, we have midbrain, pons, medulla oblongata, spinal cord. In terms of ventricular system, we have the lateral ventricle, third ventricle. Between the two, we have the foramen of Monro, okay, or interventricular foramen. Between the third and fourth ventricles, we have the cerebral aqueduct. And then as the fourth ventricle continue downward into the spinal cord. This continues downward as the central canal. Okay. Arbor vitae are the white matter of the cerebellum. Okay, and then frontal lobe, right? Parietal lobe, occipital lobe. Okay, and then here we have the transverse fissure. What else? Temporal lobe, right? Sylvian fissure. Right here we have the central sulcus, precentral gyrus, postcentral gyrus. The precentral gyrus, the functional name for it, primary motor cortex. Postcentral gyrus, this is also known as the primary somatosensory cortex. Okay, and then Sylvian fissure or lateral fissure, longitudinal fissure. Yeah, I think this is it. Yeah. Okay, so we'll start from the external structures. This is the dura mater, where it converges in the center. Okay, this is the falx cerebri. Okay, and then embedded within this, between the falx cerebri and the rest of the dura mater, we have a vein. This is the superior sagittal sinus. Okay, so all this, the falx cerebri and the superior sagittal sinus, lie in that longitudinal fissure. That fissure between the two cerebral hemispheres. So this is, again, superior sagittal sinus. Okay, there is one that travels over here. That's the inferior sagittal sinus, not visible on this model. This one is the transverse sinus, so transverse sinus. Okay, and then we can't see the the falx cerebelli here very well, but it's basically the meningeal layers of the dura mater merging in between the two cerebellar hemispheres. Okay, and then the part of the meningeal dura mater that merges in between the cerebrum and the cerebellum, that's the tentorian cerebelli. Not very well visualized here as well. In any case, this is actually the insula. So if we pry apart temporal lobe away from the parietal and frontal lobe, we'll see this. Okay, so this is the insula. And this is cerebellum, and inside the cerebellum, we can see the arbor vitae, which is the white matter of cerebellum. We're going to take this out. Okay, this is the pituitary gland. It sits inside the sella turcica of your sphenoid bone. Okay, remove this as well. Okay. This is the rest of the sphenoid bone. Okay, and here you can see the superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum. Actually, this one, don't worry about it. This one, these two contain the cranial nerve 5, the second branch and third branch. First branch of cranial nerve 5 travels through here. Same thing with 3, 4, and 6 also travels through the superior orbital fissure. Okay, and then again, pituitary gland. Now look over here, this fits inside like this. Right, now we're looking anteriorly. Okay, so cranial nerve wise, okay, we can't see olfactory nerve on this one. So cranial nerve 1 is not visualized in this one. This is cranial nerve 2, optic nerve, optic chiasm or optic asthma, optic tract. Okay. Cranial nerve 3, oculomotor nerve. Cranial nerve 4, trochlear nerve. 5, trigeminal nerve. 6, abducens nerve. 7, 8, facial nerve and vestibulocochlear nerve. 9, 10, 11, glossopharyngeal nerve, vagus nerve, and accessory nerve. And then 12 is hypoglossal nerve. Okay, and then you can watch another video for the foramen of exits. I've gone through that many times. But now this is the infundibulum connecting hypothalamus. Okay, let's see, hypothalamus, right, to the pituitary gland. So infundibulum. Posterior to the pituitary gland and infundibulum. We have the mammillary bodies. Okay, and then I want to see what else we can see over here. This is our corpus callosum. Okay, and you can see that lateral to the corpus callosum, we have that space filled with CSF. This is the lateral ventricles. Okay, so we're gonna take this apart. You can see the lateral ventricles. Okay, and then this, it's over like this. So, corpus callosum, this part is the fornix. It's all part of the limbic system. Okay, so it looks like this. Okay, and this is also part of the lateral ventricle. Okay, so this is supposed to show the CSF inside the lateral ventricle. Okay, this is your thalamus. Okay, and this is basically where the two thalamic nuclei touch in the center. And there's that space in between the two thalamic nuclei. Okay, and that's your third ventricle. So again, this is the CSF within the third ventricle. And between lateral ventricle and the third ventricle, we have the interventricular foramen, also known as foramen of Monro. This is the cerebral aqueduct between third ventricle and fourth ventricle. So the fourth ventricle, you can see, is at the level of the pons. Okay, and then also at the level of cerebellum. The cerebellum is, sorry, it's, you might have to use the image to look at that, but the cerebellum is going to be over here. Okay, what else have we got over here? I'm going to remove this. Again, this is the thalamus. Okay, and then midbrain, pons, medulla. Posteriorly, we have the pineal gland, which secretes melatonin. We got the superior colliculus, inferior colliculus. Combine it with the other side, superior colliculi and inferior colliculi. And these are the four bodies that we call corpora quadrigemina. Corpora, again, is bodies. Quad is four, so corpora quadrigemina. Okay, so that includes the superior colliculi and inferior colliculi. This is the cranial nerve 4 that we pointed out earlier, the trochlear nerve. Okay, and this is that space containing CSF, that's the fourth ventricle. Okay, and these are nerves that's traveling to the cerebellum. So you can see that the fourth ventricle continues downward into the spinal cord as the central canal. I wonder if we could see it on this model. Yeah, you can see this is the central canal. Okay, entering into the spinal cord. Okay, and yeah, on the sagittal section we can see this is the hypothalamus. Am I missing anything? Yeah, I think this is all. Okay, we can stop. Back to this model, optic canal. Okay, and then internal acoustic meatus, jugular foramen. Okay, through which the internal jugular vein also travels through. On top of cranial nerve 9, 10, 11, glossopharyngeal, vagus, and accessory nerve. So 7 and 8, which are facial nerve and vestibulocochlear nerve, travel through internal acoustic meatus. And then there's this one, hypoglossal canal, which cranial nerve 12, hypoglossal nerve travels through. Okay, cranial nerve 2 travels through optic canal. And then 3, 4, 6 through superior orbital fissure. And the first branch of trigeminal nerve also travels through this. Second branch of trigeminal nerve travels through foramen rotundum. Third branch of trigeminal nerve travels through foramen ovale. Okay.